Let's talk about haematometria, which is when the blood gets trapped in the uterus. Now, before this is another fear unlocked, it is so important just to know about it, but it is a rare condition. In the 18 years of my career, I've only ever come across it once, and that was because of an imperforated hymen. But there are many different things. Usually it could be because of urinary and duct abnormalities. And in older women, it can be secondary because of a carcinoma of the cervix or cervical stenosis. Anything that's going to tighten the neck of the womb, so the cervix, which allows the blood flow to come out of, is going to mean that the blood will back up into the uterus. So infection, rarely there is a complication after childbirth as well that can happen, and sometimes it could be scarring or adhesions after, say, a termination. So haematometria could be picked up because actually there's a loss of periods, amenorrhea, and usually if you've not had a period for 3 months or more, then you need to go and speak to the doctor. Low abdominal pain, swelling and tenderness. It can also be presented with sort of very heavy, painful periods. You could be getting small bits of period. It may present with severe primary dysmenorrhea or painful periods. It can also present with pyometra, which can happen after termination of pregnancy. It's when you have a high fever, and also you can get an infection with it as well. Now, if there's an imperforated hymen, then you can get like a bulge that can exhibit a bluish discoloration. So it is something that can be exquisitely tender. The way we would diagnose it is on an ultrasound scan or an MRI scan, especially an MRI if the ultrasound scan isn't clear. So the only way to treat a haematometria is actually, it all depends on the cause. Usually it's surgical. If it's an infection, we would need to treat the infection. But if, for example, if it's an imperforated hymen, then that would need to be incised or cut away or surgery done to relieve the pressure out of the uterus. Now, there is a rare complication that can happen. You can get urinary tract obstruction or urinary retention. So a small group of women and girls can be left with urine issues. Luckily, haematometria doesn't present that often. Like I said, I have not seen it that many times in my career. In my 18 years, I've only ever seen it the once. But it is something that we need to be aware of because it can get missed if you're not thinking about the diagnosis, or if you've had this, you're probably thinking, where do I go for information? I hope that's been useful. Please leave any comments down below and I'll try and answer any questions that I can.